Fibroadenoma is a common non-cancerous breast tumor that primarily affects women, especially those between the ages of 15 and 35. While hearing the word tumor can be alarming, it's important to understand that fibroadenomas are not cancerous and do not turn into cancerous tumors. To understand fibroadenomas better, let's first talk about breast anatomy. The breast is made up of three types of tissue. First, the lobules, which are milk-producing glands. Then the ducts, which are tiny tubes that carry milk from the lobules to the nipple. And finally, stroma, which is fatty and connective tissue surrounding the lobules and ducts. A fibroadenoma typically develops from the lobules and surrounding stroma. These growths are typically firm, smooth, and rubbery to the touch, and they move easily under the skin when manipulated, which is why they have the nickname breast mouse. This mobile characteristic is one of the reasons why fibroadenomas are often distinguishable from other types of breast lumps. Fibroadenomas can vary greatly in size. Some are so small that they can only be detected through imaging tests, while others can grow large enough to be easily felt or even seen. Most fibroadenomas are about 1 to 3 centimeters in diameter, but some can grow larger, sometimes up to 5 centimeters or more. Despite their size, these lumps generally remain painless, though some women may experience tenderness or discomfort, particularly if the fibroadenoma becomes large or is located in a sensitive area of the breast. So, how common are fibroadenomas? Well, these tumors are quite prevalent, especially among younger women. It's estimated that about 10% of women will develop a fibroadenoma at some point in their lives. They're most common in women between the ages of 15 and 35, but they can occur at any age. Causes of fibroadenoma. The exact causes of fibroadenomas aren't fully understood, but several factors are thought to play a role in their development. Hormones, particularly estrogen, seem to be a significant factor. This is supported by the fact that fibroadenomas often appear during puberty, pregnancy, or while taking hormone therapy, which are all periods when estrogen levels are elevated. Genetic factors may also contribute to the development of fibroadenomas. Some studies have found that women with a family history of fibroadenomas are more likely to develop them. However, no specific gene has been identified as the culprit. Reproductive factors can influence the risk of developing fibroadenomas. Women who have their first period at an early age or who have a later menopause may be at higher risk, likely due to longer lifetime exposure to estrogen. On the other hand, women who have had children, especially before the age of 20, seem to have a lower risk of developing fibroadenomas. Diet and lifestyle factors may also play a role, though the evidence is less clear. Some studies suggest that a diet high in fruits and vegetables may lower the risk, while high caffeine intake might increase it. However, more research is needed to confirm these associations. Symptoms of fibroadenoma. The symptoms of fibroadenomas can be subtle, and many women discover them by chance during a self-exam or a routine medical checkup. The most common symptom is the presence of a palpable lump in the breast. This lump is usually firm, smooth, and well-defined, with a rubbery texture. It moves easily under the skin and is often described as feeling like a small marble or a rubber ball. In most cases, fibroadenomas are painless, but some women may experience mild tenderness, particularly if the lump grows larger or is located near sensitive tissue. Most fibroadenomas are small, about 1 to 2 centimeters in size, and remain stable. However, some can grow larger, potentially reaching several centimeters in diameter. These larger fibroadenomas, called giant fibroadenomas, can cause the breast to become visibly enlarged or distorted. It's worth noting that fibroadenomas can be affected by hormonal changes. Some women notice that their fibroadenomas become more prominent or tender just before their menstrual period. During pregnancy, fibroadenomas might grow rapidly due to increased hormone levels. It's important to note that while fibroadenomas are benign and generally harmless, any new or unusual breast lump should be evaluated by a doctor. This is because other conditions, including breast cancer, can also cause lumps in the breast. While fibroadenomas themselves do not turn into cancer, it is possible for a woman to have both a fibroadenoma and a malignant tumor in the same breast, so careful evaluation is crucial. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of fibroadenoma. Diagnosing a fibroadenoma typically involves a combination of physical examination and imaging tests. When a woman or her doctor discovers a breast lump, the first step is usually a clinical breast exam. During this exam, the doctor will carefully check the lump, noting its size, texture, and mobility. If a lump is found, the next step is usually imaging. The most common imaging tests used are mammography, ultrasound, and in some cases, magnetic resonance imaging, MRI. Mammography is an X-ray of the breast, but it's not typically used as the first imaging test in younger women because dense breast tissue can make the images harder to interpret. Ultrasound is often the preferred initial imaging test, especially for younger women. It can help distinguish solid masses, like fibroadenomas, from fluid-filled cysts. MRI might be used in certain cases, particularly if other imaging results are inconclusive. While imaging can provide valuable information, a definitive diagnosis usually requires a biopsy. There are several types of biopsies that might be used, including fine needle aspiration, core needle biopsy, and excisional biopsy. In fine needle aspiration, a thin needle is used to extract a small sample of cells from the lump. A core needle biopsy uses a larger needle to remove a small cylinder of tissue. In an excisional biopsy, the entire lump is surgically removed for examination. The tissue sample is then examined under a microscope by a pathologist to confirm the diagnosis of fibroadenoma and rule out other conditions, including cancer. Treatment for fibroadenoma. The approach to treatment can vary depending on factors, such as the size of the fibroadenoma, the woman's age, and her personal preferences. For many women, especially those with small fibroadenomas, the recommended approach is often watchful waiting. This means regularly monitoring the fibroadenoma through self-exams and follow-up imaging to ensure it's not growing or changing. Many fibroadenomas will remain stable or even shrink on their own over time, particularly after menopause when hormone levels decrease. If a fibroadenoma is large, growing, or causing discomfort or anxiety, removal might be recommended. There are several options for removal. Surgical excision is the most common method. The fibroadenoma is surgically removed under local or general anesthesia. This procedure usually leaves a small scar but allows for complete removal of the lump. Vacuum-assisted excision is a minimally invasive procedure where a small incision is made and the fibroadenoma is removed using a special vacuum-assisted device. This method typically results in less scarring than traditional surgery. Cryoablation is another technique that uses extreme cold to destroy the fibroadenoma. This procedure involves inserting a thin, hollow needle into the center of the fibroadenoma, and then liquid nitrogen is used to freeze and destroy the tissue. Over time, the body absorbs the dead tissue. Cryoablation is generally reserved for small fibroadenomas and is considered a safe and effective alternative to traditional surgery. After treatment, whether through monitoring, surgery, or cryoablation, most women with fibroadenomas can expect a full recovery with little to no long-term impact on their breast health. However, it's important to note that while fibroadenomas are benign, having one slightly increases a woman's risk of developing breast cancer in the future. This increased risk is small, and most women with fibroadenomas never develop breast cancer. However, it does mean that women who have had fibroadenomas should be vigilant about breast cancer screening. Now, we want to hear from you. Do you or someone you know have fibroadenoma? What treatments did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.